In what's considered traditional health insurance, um, the insurance, and this is one that's been around for many years, um, they pay for all or a share of the cost of covered services. It's called a fee for service plan, so it is depends on what you had done, how much you pay. So per item, per thing you have done is how the cost is determined. It is the most flexible amount or type for patients, but it also costs the most. The fee schedule amounts are determined by what's called usual, customary, and reasonable service, and that's the amount that they're going to pay in a particular geographic area. And this area would be included with even Lexington area, um, and it considers what providers of the similar type would um, would usually charge in that area, and then from that they determine how much they will cover. Managed care organizations are another big part of insurance coverage over the last several years. Um, Basically, companies um, provide quality, cost-effective care. There's a number of reasons why it was thought this was going to be a good plan. It was going to save cost. It was also going to provide better care. It was their reasonings. And what they do is negotiate reduced rates with certain providers in hospitals. So they bargain with them on coverage, basically. Um, and they require each patient to choose a primary care provider. So they have to, the patient has to determine, who do I want to be responsible for my care? And anyone they see after that, other than that, has to be referred by the primary care provider. And typically, pre authorization is required um, for many of the things that might be done with that patient. So it's kind of levels of control to ensure that it's the better coverage for the better price, essentially. Managed care organizations, there's three different models of these. It is coordinating patient care through certain networks of providers and hospitals who agree with their particular services and reimbursement for their charges. Uh, they fall into three types: health maintenance organizations, and under those, the person has to pick out a participating provider. Um, there's also preferred provider organizations and exclusive provider organizations. Under the HMOs, typically the person has to have what's referred to as a gatekeeper. That's the doctor who or provider who oversees all their care. Um, and if they go outside of that network or outside of the uh, particular pattern of acceptance, they can actually end up paying all of their bills. They have to stay within that, excuse me, within that network. Um, Something else with the HMOs, especially, um, like I said, they have to pick a particular provider, and there is the potential of incentives for the provider um, to reduce the cost of that uh, patient's visits. Um, so prescribing more cost-effective medication might be one of those. Um, Maybe caring for the patient themselves as opposed to sending them to a specialist. So there could be good things and bad things with this. You hear stories where patients maybe felt they should be seeing a specialist, but the health maintenance physician says, I can care for you here. So without the referral, they can't go and be covered under the insurance. Also, they have what's called a um, head amount of money that's given per person. In other words, for every head that they cover, they get a certain preset fee. If they send patients to provide or to specialists, then they will be handing off part of their fee to a specialist. So one of the issues there can become um, by patients maybe complaints where they don't hand them off to a specialist as soon as they think they should, and those kind of things. So there's a lot of debate on these as, from a patient standpoint anyway. Under the HMOs, they are regulated under HMO laws. Uh, The goal, and this is something you want to remember, is to reduce the cost of healthcare overall while still providing quality care. Typically, they have low monthly premiums, low out-of-pocket expenses, but they do choose a primary care provider, um, and they won't pay for services that are not included in the provider's network. Exclusive provider organizations (EPOs) um, combines HMO and PPO. Um, they will not be covered for services outside of the network. They may not need to have a referral for services, um, and they are not required to choose a primary care physician. So at least three types of referrals patterns. A regular referral is the most common type, uh, but it may not be patient convenient. Usually those are within 3 to 10 working days. Um, an urgent referral is within about 24 hours, and a stat referral is emergency room, emergency services type things, and those can be approved online. Utilization management is a form of care that's reviewed by a healthcare professional who is not a part of the services given to the patient, but they're employed by um, health insurance companies in this case. Utilization Review Committee reviews individual cases to make sure that uh, the medical services that were given were actually medically necessary. These should be left should never be left to the patient to do on their own. These are the ones we always want to make sure we're covered before doing a lot of especially expensive services. It's our role to be able to identify the information that's on the health insurance card. On an individual health insurance card for a patient, you'll have the insurance company listed. You'll have the plan name and type. You'll have the subscriber's name and covered dependents, their identification number. Sometimes prescriber and patient is the same, or subscriber and a patient are the same person. Sometimes it may be um, whoever the insurance is under, but it's not necessarily the patient. Copay amounts should be on there as well, and the group policy number, and the plan contact numbers for different parts of services that they may provide. Verifying eligibility is where we confirm the health insurance coverage is in place for the patient. When you're scheduling an appointment, a lot of times this is where we collect that information, unless it's an absolute emergency. Um, we get the information, verify the effectiveness date. When was did this patient have insurance coverage? When did they take it out? Um, and then you review the insurer's information in online web portal. And when it's approved, then the benefits can be looked up um, in to be to specific item as to what has been covered.